Hi.
Hi, good to see you. I understand that you're interested in what a genetic counselor does. Come with me.
Oh, yes, thank you so much for doing this. First one, tell us what inspired you to become a genetic counselor?
It started many years ago, actually 20 years ago, and I realized that when I was doing genetics research that there is not enough resources and expertise in the country to help manage patients and their genetic information. So I had myself training in genetic counselling. So now we have genetic counselling here in Malaysia.
What are your thoughts on using genetic testing for preventive measures? Do you consider it significant?
Yes, we can learn a lot about our health issues and health risks based on our genetic profile. So with new technologies, we can now have a lot of information based on our genetics. However, it's really important to realize that it's not only about our genetics, but it's together with all of the other risk factors, our environment, lifestyle, and so on. So having a genetic profile, it's important, but understanding what it means together in a whole big picture is very important. And that's where genetic counselling comes in. Hi.
Yoon Sook Yee, how are you? Hi.
Good. So tell us a little bit about how genetic testing can be done over here.
Oh, it's really easy. Once you have been registered, it takes about 30 minutes for the whole process. All right. We will obtain the sample from blood, drawing, Parker swab, or saliva. Once the report is ready, we will make an appointment for patients to see the genetic counsellor, just like you. That's all.
Okay.
Can you describe your job as a genetic counselor in just one sentence?
As a genetic counselor, it is my role to help an individual understand what their risk is for medical conditions or other health issues based on their genetic information.
So, can you tell us what typically happens during a genetic counselling session?
So in a genetic counselling session, we will always review what's happening with the individual's personal medical history and also the family history. This will tell us a bit more about what's happening and if there are certain things we need to pay attention to. So if there is a test that should be done or is recommended, and we can do that as well during the session. We usually talk about what are the possible outcomes of the test and what we can do after that, depending on the result of the test. With the report, we also explain what is the next step and who else they need to be referred to in order to have a good idea and how to manage their risk.
How does genetic testing inform people about disease risk and what actions can they take?
Well, certain diseases are due to an inherited genetic change. So these are genetic risks that are already there. So if someone knows that they are at higher risk, they can do something with it. So for example, in cancer or even in heart diseases and many other diseases, if you know that there is a risk, there are certain interventions or screening that can be done. And with that, we hope to reduce the chances or reduce the seriousness of the disease that's going to happen, and that will benefit the individual and their family members.
Have you seen genetic testing uncover an undiagnosed condition?
Unfortunately, yes. So there have been individuals that have come to us and I've seen where they were not expecting to have high risk of certain disease. But with the genetic profile, they then learn that they actually have this increased risk. So sometimes it can cause some anxiousness, some anxiety. And this is where we, as genetic counselors, we're trained to work with them to manage these feelings.
I see. How do you assist in alleviating anxiety and providing reassurance?
We do try and reassure patients and the individuals, right? And help them, understand their risks well. So not necessarily that it's going to be a very high risk, but maybe an increased risk, and to manage that expectation and understanding. In some cases, though, we do have individuals who are very overwhelmed and they need further professional support. So this is when we will also refer to our psychology colleagues who are trained to manage such anxieties as well.
We have one more question for you. What's the most rewarding part of your job as a genetic counselor?
Well, we see many different individuals and they're all from different backgrounds. And to be able to help them understand their medical conditions or their health risks better based on the genetic profile is very fulfilling. And this is something that, we hope that we are able to share and understand what genetic counselling actually is.
Thank you for answering our questions. We hope to see you again. Bye.
Thank you and goodbye.